Hi guys, so in today's video we will be discussing one of the most important and one of the most difficult stations in the exam. Before we move on to discussing how the exam station goes, I would like to give you a few tips regarding your IPS. Okay, so the very first thing, guys, that you need to you need to remain calm and try not to get intimidated by the situation. Also, when you enter the room, stay confident, stay loud, and when you enter, greet the examiner. Once you're in, you will be approaching the patient from the right side, and you will verbalize that you have taken all the safety precautions. Now, how will you verbalize that? You have to say that, assume, examiner, that I have taken all the required safety precautions. By saying that, you confirm that you are aware that you have to take a certain precautions before moving on and before handling the patient, which could include washing your hands, wearing gloves or an apron, whatsoever is required. Moving on, introduce yourself to the patient and ask the patient for their name and age. If the patient is able to verbalize, that means that the airway is patent. So, um, when you ask the patient for his or her name or age, always remember that there's going to be a band on the patient's right wrist, and you need to confirm that on the patient's wrist, whatever the name or age he has mentioned. All right. So, one thing that you need to confirm while you're talking to the patient is if the patient is able to verbalize his name and age, that means that the patient's airway is patent. All right. So, um, that means that you can say when you move on to your airway part, you can say that since my patient is talking, I assume that the airway is patent. Then, as you move on to your ABCD approach, according to the current event, first of all, begin with your history and your A approach, which is airway. In history, you have to ask about the current event. What happened? How did it happen? And when did it happen? Also, why did it happen? And also, along with that, you have to ask a bit of a past medical history, which will include the mnemonic MMA, which is if the patient has any ongoing medical conditions, if the patient is taking any medications, or if the patient has any allergy to any medication or any food. Moreover, another important question that you need to ask, if you skip this, you will not be able to pass this station. So make sure you ask about smoking or COPD. All right. Always remember to ask. Um, you can verbalize it in a way that, all right, so do you smoke or do you have any diagnosed condition known as COPD? So why is it important? It is important that because when on your first step, while you are looking at the airway, you will first of all look at the monitor that has been given right in front of you. All right, right there you also need to verbalize that now I am looking at the monitor and the monitor says that the oxygen saturation is 86%. So if the oxygen saturation is not normal, now you need to give the patient some oxygen, and whatever mask you will be using in that case should be according to the situation. If the patient smokes, it's going to be a different choice of mask that you will be taking. If the patient doesn't, that means that you can give 100% oxygen flow. So that is why it's extremely important to ask that question. All right. So moving on. Now, one more thing that you need to check is check for any swelling in the tongue or lips, and check for any foreign body, and also just keep an eye on the patient's chest while you are giving the patient some oxygen. So that concludes your airway. Moving on to breathing. And once also remember that once you have given the patient some oxygen, uh, ask the patient how has he been feeling any better since he started taking the oxygen. So you can always, after every step that you make, you have to ask the patient how he is feeling. So, in the breathing part, first of all, you need to check the monitor and check the respiratory rate and verbalize. While you're at it, keep verbalizing whatever you're doing. Then you need to examine the chest. So before touching the patient, remember this, do not touch the patient without asking for consent. So, before touching the patient, ask for consent and mention having a chaperone by your side. Explain what you are going to do. So, I would like to examine your chest, and I will look, feel, tap, and listen to your chest. Also, I will be checking the position of your trachea as well, and I will have a chaperone by my side. So while you're examining the chest, once you're done with that, move on, and you may need to get a chest X-ray done or an ABG done. All right. So verbalize that as well. You don't have to actually perform that, but you need to verbalize that you will be doing that. So this concludes breathing. Now moving on to the circulation. Here on the monitor, look for BP and look for heart rate and verbalize your readings. And pinch the finger to check for capillary refill time and verbalize whatever you have found. Also, now you need to take some blood tests and give fluids to the patient as required according to your reading. So you need to verbalize that now you will be putting in a wide bore cannula, and look for the wide bore cannula, whatever is needed according to the station. You have to pick that up from the trolley, and you should be able to identify the type of cannula you need at a certain time. So verbalize that now that you have taken the cannula, you are going to uh, insert the cannula into the patient's vein. All right. So while you're doing so, verbalize that, all right, and tell the patient. So there's a sharp scratch coming in, so that the patient knows that you're now going to insert the cannula. All right. Once you're done with that, verbalize if you are going to give any fluids. You also need to find the fluid bag in the trolley, whatever the fluid is required according to the situation. Look for the fluid bag in the body and pick that up. And then mention that, okay, so you will be giving a certain fluid to the patient. And along with that, you will be taking some um, routine investigations, and you'll be taking some samples for that. So verbalize everything that you've done so far. Also, in a circulation, you may also need to get an ECG. So mentioned towards the end. So and now that I will be uh, taking the reading for your ECG. Up next, we have deformity. All right. Here, your aim is to check the GCS level of the patient. So check for pupils. Find a light torch in the trolley again and check the pupils. Check the blood sugar levels and temperature, and ask the patient to move his leg, both the legs, left and right, and assess for the movements and check for the GCS level. Lastly, exposure. All right. So ask the patient for consent to expose him from tummy and below to the legs. So verbalize it. I'd like to check your tummy and your private area and your legs. So is it okay if I expose you down your tummy? Look for any rashes, any swellings. Compare the temperature of the legs with the rest of the body. Check for pulses. If you find one of the pulses in the leg, that's fine. You don't need to check all the pulses. Just look for one of the pulses. And once you're done, now, once your patient is stable, you have followed the whole process of A, B, C, D, E. You're done, and your patient is now stable. Of course, there are going to be other steps, a few more steps according to each situation, but this is the basics that you need to follow. Even if you are able to follow A, B, C, D, E completely, you will not fail the station. So, once you're done with that, now it's time for you to follow an approach which is known as ISBR, which is a mnemonic to present your findings and talk to the examiner. Once you're done, now you need to face the examiner, and now you need to talk to the examiner about what you have done. All right, so let's discuss what ISBAR stands for. I stands for introduction, S stands for situation, B stands for background, A stands for assessment, and R stands for recommendation. So, in introduction, you have to introduce yourself to the examiner. All right. So, my name is Dr. Zara, and today I saw a patient with hematemesis, for example. All right. Explain the situation. All right. So, I saw a patient named Robert whose age was 40 years old, and he presented with a complaint of blood in vomiting with blood. Then also give a bit of a history in background. You have to give a history regarding how it started, when it started, and what happened exactly, and any risk factors you found out, or do you see any underlying causes at all. That is something that you will be covering in the background. Now, assessment means that all the steps that you undertook through the process A to E, you have to explain those, but you only need to explain a summary of those, because you have been verbalizing everything so far, so give a summary of everything. And eventually, the R recommendation, in that part you need to explain that what further management would you suggest for the patient. So, for example, if you need to admit the patient, or you want to take the patient, you think that it's best to take the patient to directly to the OT. Of course, you're not going to do it all by yourself. You will be referring patient to a certain specialist, and you will be suggesting what the specialist will be doing further. All right. So that's all for the video. Also, while you're at it, make sure that in between you are able to complete your ICE. ICE means I for idea, C for concern, and E for expectation. So this you need to ask from the patient along with your history. So, do you have any idea what's going on with you? Do you have any specific concern? And do you expect anything else from the consultation or from the treatment plan that we have? Okay. So, while you're taking your history, and once you're done with that, and once you see that the patient is stable, now you can ask these three questions from the patient before turning towards the examiner. All right. So that is all for today. I hope this video was able to help you with the basics of Simman station. And thank you so much for watching.